your Tech Care podcast with me, Sangha, and my awesome co host, Morton. Today we have with us Victoria Bayer, MD of Bayer Consulting. She is also the chair of HUK Lancashire. Now, Victoria and I, we go, oh my God, long years,
way
isn't
back,
it?
Sangha.
Yeah, so Victoria and I, we did a small gig in the children care sector. That's a different story for some other day, but Victoria, welcome.
Thank you so much. Thank you for having me today, especially on my birthday. What a great way to start the day, having a conversation with Morton and Sangha.
Congratulations. Fantastic that you join us on your birthday. I would have hoped for you, and maybe that goes for the next birthday then, that you take the day off and properly celebrate instead of spending time with silly podcast people.
Well, no, it's a great way to talk about all the stories and everything that we're doing currently. So yeah, work, fusion, life, it's all one thing. That's the great thing about tech.
It is more fluid today, isn't it? Yeah. When I compare it to my parents' life, I often think that they were a lot more 8 to 4 or 9 to 5, and if they were working late hours, they'd always try and catch those up on another time. And yeah, it's something else today, isn't it? But really, before we go into all of that, Victoria, as you guys know each other really well, I'd love to know more about you.
Thanks. Well, my background is pharmaceutical manufacturing and drug design, and I spent about 14 years working through corporate pharma, including GlaxoSmithKline, worked for Boots and the wholesaling arm for a number of years, then went contract manufacturing antibiotics in Oman. So I worked in the Middle East for a couple of years, came back and got into medtech and device development, eventually going to quantum pharmaceuticals, where I was commercial director. And every business that I sort of skipped along through, it was all corporate and commercial. And I kept thinking about who accesses the care? Where does this actually happen? And almost it was a revelation that local authorities and that lots of independent care providers who are supporting millions of people up and down the country. I got the idea of the hospital and the doctors and all of that, but I never really thought about social care. So I had a bit of an epiphany and thought, I'm sure I can take some of my skills there. I'm sure people are looking for commercial technology, enterprise development, corporate transformation. So I headed off and went to work for a couple of the big London housing associations, Circle as was then, and just really found it fascinating. Then ended up in a mental health foundation trust at Tavistock and Portman for all sorts of interesting reasons. That was a development into kind of redesigning children's services, older people's services, very complex specialist forensic type services. And then Sangha and I got together and did our little dance in adoption and fostering. And after that, it became a sort of portfolio business. And I just merged into working corporately for different individual organizations, whether they were charitable or for profit, doing a whole range of different things. So medtech device and startup type businesses, charitable organization, commercial strategy. And now I'm kind of a hybrid of all different things, working primarily for a number of the big care trade associations. So I am the program manager for the Care Provider Alliance, which represents 75% of the whole of social care. And I've been 4 years at Age UK Lancashire now, which is fifth largest in the group. We're on our way to 5 million turnover this year. We support 22,000 people every year through our information and advice service. We take home and settle people from hospital all across the county. It's a super busy organisation. When I came to join with them in 2019, they were in a turnaround, material deficit, and we had to do everything from the ground up. Look at the telephony systems, look at the IT systems, look at the back office functionality, finance. And fortunately, we're looking pretty healthy now. So good surplus in the bank, and we get to invest in different things and new technologies. And COVID was a blessing. So it digitally transformed our care services in a completely revolutionary way. Probably because we were forced into it and the staff kind of had to just adapt. But they were all things that, in the mind's eye of the board, we really wanted to do. We just hadn't had the incentive to get there quickly. And charitable organisations, particularly voluntary sector, community enterprise, social enterprise, community interest companies, they go at a slower pace than private equity and PLC backed businesses because they haven't got the funding or the strategic capability and analyst support there. So hopefully that's something that I bring, is a bit of a human side to it with a very corporate but cautious commercialism.
You know
That's
what?
fantastic.
That was one of the best introductions I've ever heard of someone saying what they'd done throughout their whole career and work life.
Thank you so
Bravo.
much.
But there was one thing in there that, of course, in the eyes of this podcast, really sounded super interesting. You said that COVID was a spark for a digital transformation for the organization. Can you say a bit more about that? Where did you come from and what did you do throughout that process?
I think it was the fact that suddenly we were propelled into online. So, like I'm talking to you today, we're doing it digitally through the interface of the Tinterweb, whatever you want to call it. And so, by moving quickly into a board structure that was online, so we had to go to digital board packs because previously we were printing out a tree. Digital also saves the environment. Let's really not move away from that as a mantra for doing things well. But because we were more focused and we came together and we could discuss more rapidly ideas, I think that's what self-seeded the idea of, okay, so we've got this old black box sat in this office over there, but nobody's going into the office. So what happens if the server goes down? Basic critical business continuity discussions started to happen like we'd never had before. And then we thought, and how are we going to get into people's homes? So today we could walk through the door and, take their shopping or support them with whatever they need, help them think about their benefits advice, help them think about cleaning the house, all of those sort of functional things that we were doing. But suddenly we couldn't do that. And we couldn't touch money. It just, okay, here's a problem. What's the solution? And everything went back to, we're going to have to rethink the human interaction. How can we make it seamless? How can we think about infection prevention control here? And how can we do this really quickly? And by the way, we haven't got much money to do it either. So effectively, smartly, cheaply, but let's think about what's in our gift to do. And we had to just look at everything, branch and root analysis really of what we were doing, which was fantastic.
But that also sounds like somewhat unlike a few of your past roles that I bet innovation was something that was pretty well funded. Whereas this one sounded like you pretty much had to also go and look what's off the shelf somewhere that we can just immediately start using.
Yeah, very much so. But I think there's two business modes for me. And, I'm not classically trained in business management, but it's either broken and you need to fix it or you're building it. So through crisis, through events happening, transformation, development, structure, all comes from that. And equally, if you have to start a project from the very beginning, you might do those sprint developments. You might make mistakes and iterate and move forward, but they're innovation through learning, facilitation, education, and communication.
And crisis.
That's a fantastic point, Martin, because, what was COVID? It was a crisis. And it did propel people to adopt innovation in a much more, I'd say, faster and better way. Had COVID not been here, we'd have perhaps as a sector taken a few more years to really get to start using technology. Victoria, one question there. Where do you see the care sector moving towards? What kind of care is the future of social care?
Really great question. I think care can be whatever you want it to be. The one thing I really am fascinated by in care delivery is how we can bespoke everything. The care plan is individualized. Humans are individualized. There is no one size fits all. And that's the care message. Using technology is only a tool within a holistic, full centered person type care delivery. And you can look at some really interesting places like, let's go to Japan, let's fly around the world. Or let's go to some of the Swedish country or, anywhere like that. They think technology in a different way. We have a bit of a blind spot in this country of, oh, the system isn't going to do it, or, oh, I am nervous or frightened, or I can't have this tech in my house because something's watching me. But everybody's talking to Alexa. Everybody's got a smartphone and they're more than capable of going onto TikTok and doing whatever if their grandkids are showing them, or, even my mum, she's just sent me a load of text messages this morning, like using WhatsApp, face emoji. She loves it all. She sent me pictures because it's my birthday.
Yeah.
She's 81. She can barely ring the phone and get through to the doctor to have a proper conversation, but the functionality of the tech in her hand is really, really powerful. It gives connectivity to an outside world. And I think that care that's delivered in a seamless way that doesn't create division, but allows us to integrate fully within people's lives is the best thing that we can do for the future.
How big a fan am I of that? I really loved how you said it can be basically what you want it to be. What's certainly lacking then, of course, is sometimes the commissioning models that they're trailing behind, which of course is the case. But if you're working with progressive commissioners or authorities, then maybe it can be everything we want. But I sometimes do feel, and it's in there in what you said also about consumer sort of behavior versus business behavior, that sometimes as a consumer, I can just be who I want to be because, yeah, I'm actually capable of it because it's intuitive or for whatever reason. But when it then becomes a business issue or a business proposition that I need to do it through, then it becomes an issue. There is something in there where I'd love for the care sector to really learn more and reach out for those off-the-shelf things or experiences and transform them into business experiences.
I think there are some great examples, though, and it takes somebody who's got vision, maybe. So, really strong creative leadership at the top is always the thing that will transform and generate new innovative models of care. And actually, innovation is a word that's sort of been around for a long time, but there is an element of there are people doing things really, really well out there already, but what we're not able to do is scale and replicate that because we don't invest. And I love that idea, Morten, about, commissioning done really well is commissioning. What we have is essentially a procurement strategy by local authorities, and it's a kind of trading floor of, oh, you have a person and here is the remuneration for that person. That isn't how it is. It's not widgets. We're not designing things for the consumer market. We're designing things for the human market. That's about living an intelligent life. That's about having a really high quality service. You can't just pluck that off the shelf, as you say, or procure it in a very binary way. It has to be well thought through and well constructed.
Yeah. You talk a lot about intelligent human care, Victoria, and love to pick your brain a little bit on that. What are you seeing? What is the general vibe in the sector? We know there's a lot of things that needs changing with regards to commissioning, and you gave a beautiful example of the difference, what actually commissioning should be versus what it is now. But what about, the care homes, the care services, the home care businesses? How are you seeing their mindset changing or not changing in the process?
I always go back to it's the rule of a third. There's probably a third of care operators, and it doesn't matter whether they're tiny, small individual organizations or, multiple sites with a huge turnover. There are those businesses that have gone, this is a way to do it. We can, optimize our staff environment. We can give them flexibility because lots of care staff don't work full-time days. They work flexibly. They've got other things going on within their lives. And getting that right, and then getting the care experience right for the individual who's accessing it is part and parcel of the DNA, for example, of that organization and the way that they operate. Then I think there's that broad group of people in the middle, the other third that are kind of reaching up. They want to go on the journey, but they don't quite know how. They need proper resource, they need guidance, they need some experts to help them design things, or just peers that they can really talk to and ask the tricky questions. How many chief execs would sit in a room and say, "Oh, I've got this problem," or "I haven't been able to fix this solution"? We just don't give them the space to have those conversations and really learn from one another and bounce ideas around. And that's because the care business is super busy, it's 24/7, there's no respite. So, how do you have that creative thinking space? How do you go away and think, "Oh, this is the way I could do something, let's explore it"? We don't give people time. And that's what they really need. And then there's a third of the market that's probably going to be quite slow to catch up, maybe isn't the highest quality service provision. They're probably where we need some more guidance centrally, whether it's central government or it's local authority driven, or actually it's the sort of population at large that says, you can do better. We expect this. Within banking, it's completely transformed and digitized in the last 10 years. It's been very disrupted. If the groundswell of the consumer, the care activists, who we all are, is saying, actually, what kind of care would I like in 20, 40 years' time? What should my mother be expecting in her journey in the next 10 years? Well, there's some really great things. And I could see that hybrid living, in a community where she's got connectivity, something that looks more like residential supported living would be probably the right thing for her. She's not going to move away from her friends. She wants to be together. I certainly want to be in a situation where maybe some of my friends are all living together and we're bringing the care in. We might have chef visiting us once a week and having something that's very different than what we have today. But nobody's saying, this is my expectation. This is what I'd like to see. And so we really need to drive those messages out into the sector.
Are you expecting that to come, as you're saying? I'm hearing at least that there is a possibility of us voicing this all together, and then thereby services will also change, or that could be an expectation at least. But are you also seeing providers leading that line and saying, well, actually, we can offer something else out there? We're seeing a different need.
I think so. And as I say, they're in that top third of, we're already doing this and achieving it well. The problem is that we've got a split market. So those people that can afford to pay are probably able to access it. And we're materially disadvantaging other people who haven't got the availability of funding. The local authority doesn't see that that's the right support package for them, whatever the intricacies of the funding arrangements. And that's the one thing that we probably need to fix is, here is enough money. We should be supporting everybody equally, regardless of their need. That's one of the things we really need to tackle to make this work effectively for the long term.
I 100% agree. And I love that Sangha's door just opened behind her.
And guess who it is? It's the dog. And
it's the four-legged person.
And I'm trying to, I thought it was someone else, and I'm trying to, indicate go, and then I see it's he.
It is fantastic because it's definitely a four-legged creature that we've had on a few of these episodes now, so I don't mind it at all. I think we should place him at the center of the podcast soon.
Looks like he wants to participate in this. Victoria, you are also doing something really cool. You are going back to university to learn something. Why don't you tell us more about that? I thought that was very inspiring.
Was deadline day. I had to get my first assignment in. I was like a kid. Mind blown. I'm totally mind blown. So I've gone back to do my general diploma in law, so a law conversion. I must be crazy. Who works and goes back to study?
I think a very clever person does that.
Well, somebody either very naive who suddenly thought, oh, I can just fit this in around everything. So I'm at Birkbeck University. It's been fantastic. What an immersive experience I've had the first 2 weeks. Intensive, really intensive. Doing the foundational module, which is the general legal skills. Amazing. Shout out to Dr. Kojo Koram, who's my course lead. He's been fantastic. And the team of students that I'm in are all postgraduate, really interesting colleagues as well. So we've set up a little WhatsApp chat. And yesterday we had to get our first assignment in, which was a case commentary. And I actually did the case, which is Brooks versus the Metropolitan Police. So Dwayne Brooks was the friend of Stephen Lawrence. Fascinating case to really explore and understand in that level of detail. And it threw up some of the same conversation topics that we're having today, which is where's the duty between the authority and the state versus the individual? What should we be doing to reform diversity, inclusivity? So part of his claim originally was against the Race Relations Act in the Met Police. And that was kind of chucked out really early on in the court proceedings, which is fascinating when you think that was 2005. And here we are in 2023, and how much we talk about diversity, inclusivity, equity of access, kind of the language was really powerfully toxic then. And things haven't actually changed within the police force in that period of time as well. There's the Dame Casey report, which says the same things about institutionalized discrimination. And that's kind of transcending lots of our public services in a really powerful and pervasive way. So if tech can do anything, it's to maybe take down some of those borders as well about gender and equality. And I'm all in for that.
Yeah, I'm a big proponent of that as well. I think with everything around, tech does break up barriers to colors, barriers to gender, barriers to biases. So that's a topic for another day, I think. But yeah, I'm so inspired by you, Victoria. You are amazing. And thank you so much for coming.
Thank you very much, both of you. Great to see you. Great to have a morning conversation. I feel inspired now. Well, let's see what happens for the rest of the day. I might just eat cake.
Certainly the answer, but we hope that you get a fantastic day on your birthday. And
thank you so much.
Thank you, Victoria.
Thank you for listening. Don't forget to subscribe, review, and share your favorite Take Care podcast with your friends and colleagues. Until we meet next week, take care.